my name is Caroline and I'm a registered veterinary technician here at Selkirk Veterinary Hospital, and I'm going to talk to you a little bit about Pet First Aid as it's Animal Health Week from October 4th to October 10th. We are giving away a Pet First Aid kit to those of you that like or share our videos, and we hope that you find them instructional. I'm going to go over what's in this Pet First Aid kit first of all. Things that you can have maybe lying around the house, or you can purchase these online as well. This one is from St. John's Ambulance. When you open it up, immediately you see it's nicely packed and very easily accessible. We have some rubber gloves, some latex gloves that you can use for any number of things. If there's any vomit or blood or anything that you're not sure of, rubber gloves are always a good thing to have in your first aid kit. We also have a roll of tape, scissors, tongue depressors, small forceps, some gauze, some alcohol swabs, and a tensor bandage. These are all very useful things in wrapping minor wounds before you can get to the veterinarian, or pulling out bee stings or wood splinters or glass pieces cut in foot pads. And then on the other side, we have things that you may not use as often. We have some emergency drinking water. We have a styptic pencil, which means it will help control the bleeding. More water, more gauze, a syringe, a bandage or a splint that you can use, some gauze, and a splint that you can actually cut and form into a specific shape to cushion your animal's leg until you can get into the veterinary clinic. Here we have Lady, our willing participant. We're going to show you guys how to approach an injured animal and to transport that animal into your vehicle or to get them into the veterinary clinic. If Lady were injured in any way, we would want to make sure first that she would be approachable, and if not, we'd always want to protect ourselves because an injured animal may bite or scratch or even run away. So it's very important that we take things nice and slow with any type of injured animal and protect ourselves at the same time. It's always handy to have a type of towel or a blanket in your car as well, and easily enough to, if they are lying down or facing away from you, placing the towel just around their head, just nice and gently, but this gives you a nice barrier if you need to pick up the animal gently and safely, and then they won't be able to bite or scratch at you. If you need to use the blanket as a carrying option as well, you can do that in any other way. Make a little sling out of it. If the animal is laying flat enough and is gentle enough for you to be able to make a sling, you can have somebody on one end of the towel, on each end of the towel, and just make a gentle sling or a hammock to carry the animal in and nice and gently to make sure that they're supported properly. Another good thing to have, in case the animal is not as friendly as little Lady here, is any type of slip lead or rope or gauze, and that's very easy to use as a makeshift muzzle. So we are just going to open this nice and wide and slip it over the animal's mouth if they let us, and you can get close enough, and then just gently tie it around the muzzle like this, and this will prevent them from being able to open their mouths and bite if they're sore at all. So these are ways that you can always protect yourself when dealing with an injured animal. Things that you're looking for on the outward side of the injured animal is any bleeding from the face or the head or the mouth, any type of wounds or injuries to the legs or to the rest of the body. These are things that you need to look for before you approach the animal and try to pick them up because we're not sure maybe where they're painful. If the animal is not too injured and looks fairly bright and alert and is friendly, or if it's your own animal, feel free to see if you can monitor any of their vital signs. These are things that any of the people that answer the phone at a vet clinic may ask you before you bring them into a clinic. Things that you can check yourself are things like feeling for a heartbeat. Generally, the best place to feel for an animal's heartbeat is on the left-hand side of their chest, just behind their elbow. On Lady, it may be a little difficult to see. She's got little daxy legs, but right here is her elbow where it bends, and right here is usually where their heart should be. So you can definitely have a little feel, place your hand in between the armpit, and you can count and see how fast it's going. Some people will count over to about 10 seconds. And her heart rate is about 96 beats per minute. Just doing a bit of math in my head. And that's fairly normal for a dog that may be a little bit stressed out and not in any pain at this moment. We can also check an animal's gum color. A gum color is a great way for us to see if they're going into shock or if they're losing any blood. And by doing that, we can just lift up her gums here, and we see a nice pink color all along the side of the gums. The tongue is a nice bright pink, and that will tell us that she's getting enough blood through all the areas of her body. And then we can also push on those nice pink areas, and it goes a little bit white and then right back to pink. 1 second, about 1 second it takes to go back to pink, and that's normal as well for a dog. If we see any color like blue or purple or white in the gum area, or that takes more than 1 or 2 seconds to come back, those are all signs that we may need to see them sooner rather than later. I'm not going to go over a temperature at this point. It's very difficult to take a temperature on an animal that might be stressed out or in pain. We can worry about that when you get them into the veterinary clinic. These are two very basic things that you can do: is check a heartbeat, watch their breathing, and check their gum color for any type of distress. With everything, always remember that a basic pet first aid kit is no supplement to proper veterinary care. Please do your best to stabilize however you can and get them to a veterinarian as soon as possible to be able to treat any injury. We definitely appreciate at-home care as best as you can, but nothing can substitute all the pain medication and possible emergency life-saving measures that we can do here at the clinic.